Hi guys, my name is Allison Podborny, and today this video presentation will hopefully teach you a little bit about spine boarding. You're going to learn about when to spine board, how to spine board, who to spine board, what to do with the equipment that they're wearing, whether they play football or something like that. So hopefully you take away a little bit of knowledge from this presentation today, and you can say that you learned something. So let's get started. According to the journal titled National Athletic Trainers Association Position Statement, Acute Management of the Cervical Spine Injured Athlete, it states that the incidence of spinal cord injury in the United States is estimated to include 11,000 new cases each year. Serious spinal injuries have a devastating impact, including neurologic impairment and premature mortality. Sport participation constitutes the fourth most common cause of these injuries overall, but it is the second most common for those younger than 30 years of age. Approximately 7.4% of all catastrophic spinal injuries occur from sport-related incidents. Since 2000, the majority of all cervical spine injuries have occurred in individuals between the ages of 16 and 30 years old. American football in the United States is associated with the greatest number of catastrophic spinal injuries for all U.S. sports. Although catastrophic cervical spine injuries have decreased compared with the incidence in the early 1970s, an average of 7.8 catastrophic cervical spinal injuries with incomplete recovery and quadriplegic events occurred in football alone. Along with football, gymnastics, cheerleading, swimming and diving, lacrosse, and ice hockey all place participants at risk for a catastrophic spinal injury. No matter what the sport may be, these athletes are involved in, making sure that we know and have the proper means to treat them is key to a full recovery. Working as a healthcare professional, knowing how to spine board is very important. A healthcare professional is considered an athletic trainer, a physician, EMS, anyone like that. We all hope to never have to use this technique, but one day you just might have to, so knowing how to is very important. A spine board is a device that is normally hard plastic, around 6 to 7 feet in length, and has a set of handles on each side. During a sporting event, if an athlete were to go down with what we suspected were a spinal injury of some sort, this is a device that we would use to get them off of the field and onto the ambulance. There are many things that go into spine boarding. Making sure that it is being done correctly and how to get the athlete onto the board off of the field is one of the first things to talk about. If EMS is there, they will be assisting in getting the athlete onto the spine board. Most likely for any scheduled sporting event, such as a game or some kind of competition like that, EMS will be there. But if it's something as a practice and EMS is not present, then make sure to call 911 immediately if there is a spinal injury suspected. Getting EMS there as quickly as possible is very important. The next process can start without EMS if they are not present, but making sure that you have people who know what they are doing and have been trained and taught this skill before jumping into it is very important for the safety of the injured athlete. Do not let someone just try to spine board it when they don't know what they're doing or they've never done it before. Step 1. When walking up to the athlete, check and make sure that their breathing is okay. If the breathing of the athlete is okay, then continue on to step 2. If not, then follow these steps. If the athlete plays football or ice hockey and has a face mask on, remove the face mask with the necessary tools to do so. All staff should be trained on how to use these tools for an emergency situation just as this. Once the face mask is removed, begin breaths. The best way to do this would be the head tilt chin lift, but this can also put the athlete's already compromised cervical spine in an even more compromising position. If there is an obvious cervical injury and there is EMS already present, they can always use advanced airway techniques to better help the athlete. Now for the next couple of steps. These will differ depending on if the athlete was found in the supine position, which means that they were found lying on their back, if they were found in the prone position, which means that they were found lying on their stomach, or if they were found side lying. If supine, since this athlete was found in the supine position, we can make sure their arms are placed at their sides and their legs are placed together. Now we can place the cervical collar or C-collar around the athlete's neck. This helps to keep the cervical spine in place. Making sure that the C-collar is the right size for the person is super important when putting it on. If it's too small, it may not fit around their neck right, or it may compromise their airway, not letting enough oxygen in. If it is too large, it will do no good in helping to stabilize, and there's no point in even having it on. Step 3. Now that the C-collar is on, this is probably the most crucial step. This is the act of actually getting the injured athlete onto the spine board and off of the field. Being found supine means that we can do the 6-person carry, meaning that 6 people will pick up the athlete, making sure that everyone stays level and lifts from the legs and not from the low back, and then places the athlete down on the spine board. During the transfer to the spine board this way, this helps because unlike the log roll, there is no rolling involved, which is where the spine can have an unneeded shift if someone performs it wrong. The 6-person lift was found to be much more effective and much more safe of a transfer in recent spine board studies. At one point during the lift, make sure that there's an extra person on the side that is able to do a quick sweep of the spine from top to bottom, just to make sure that there are no obvious deformities present before placing them down on the spine board. We don't want to miss anything. Now going back a couple of steps, if your athlete was found prone on the field, meaning that they are lying on their stomach, or in any other position, this is when a group of people is required to perform the log roll technique. Before the log roll is conducted, if the athlete is found prone or on their side, make sure, same as before, someone runs their hand along the length of the entire spine looking for any obvious deformities. Obvious deformities would include something such as bulging, a large dip, or any kind of blood that came back on the hand of the person that did the sweep. If nothing is found, with 1 person at the head, 2 to 3 others at the rest of the length of the body, and 1 more person ready to slide the spine board underneath the athlete then needs to be rolled onto their back without much disruption to the head directly onto the spine board. This is to be done by the person at the head counting. It would go something like this. The person holding the athlete's head would say, on my count of 3, we are going to roll the athlete toward us, onto their back, and onto the spine board. Ready? They would then take a quick glance and make sure that everyone was ready. Everyone would have to respond with a yes, we're ready. And then the person at the head would say, okay, 1, 2, 3. And then on the count of 3, everyone would roll the athlete onto their back, and now they are on the spine board. Now that the athlete is on their back, we can put their arms at their sides and their legs together and apply the C-collar the same as we did for the patient that was found supine. The last step is making sure that the athlete is secured to the spine board with all of the straps being used. There's also padding or towels that should be placed on each side of the athlete's head, in between the arms and the body space, and in the space between the legs. Make sure these are all secure in place and will not move around. Equipment and padding being worn during this process is also something to be talked about. Do not ever remove a helmet or shoulder pads. These are helping to keep the athlete's spine in line, and removing only one of them will put the spine in a different position. It will no longer be straight. If the helmet is accidentally thrown off during the accident and the time of injury, do not try to put it back on. Simply place something that is sturdy under the athlete's head to make it level once again. The athlete is now ready for transportation by EMS to the hospital. Hopefully you've learned a little something about spine boarding and the transfer of the athlete today, and I hope that you can take a little bit of knowledge away from this. Thank you for listening.